To treat blood like an organ of its own is something that I've learned is super important. We look at heart health and diabetes health, but I don't think blood is something that the public or general public thinks about or talks about.
Let's maintain your blood at the level you need. So if a complication occurs and we have bleeding, you've got more in the tank. You filled your tank. So if you lose this much, whereas if you are half full in your tank and now you lose this much, that's where it gets very risky. So we want to be sure we're keeping everything the best that we can throughout your pregnancy. WHO guidance said the best blood is your own blood. Build it up in your own veins and get your own body going. They made a comment that blood is the most ignored organ that we have. Isn't that interesting? We don't recognize blood as an organ, and so we negate it. We normalize anemia. So we're ignoring probably the most important organ in your body, because without blood flowing around your body, nothing would subsist.
Well, I think there's two real problems in the postpartum period related to anemia. One is if people enter labor anemic already, they have a higher chance of hemorrhage and they have a greater need for a blood transfusion, whether it be because of the hemorrhage or actually just sheer anemia in the postpartum period causing significant symptoms. And we really do not want to be giving a blood transfusion to any woman for iron deficiency anemia. That's a very bad thing to be doing.
What you want is for that mother to build up their own red blood cells. Limiting or eliminating the need for transfusions and intervene in a different way, that can be so much better for your patient.
The big fear, especially for me, having lots of interest in obstetric hemorrhage, is that if they become quite anemic at the end of pregnancy, then that increases the risk of postpartum hemorrhage being quite large. I feel with today's knowledge, it is unforgivable for a woman to enter into labour having iron deficiency anemia. If you are anemic, your blood is just more runny. If you have a tendency to postpartum hemorrhage, you will bleed more. You're more likely to have problems. So we must get iron deficiency treated before women give birth. You will lose blood. It's inevitable, it's part of it. But what has happened all the way through pregnancy is actually you've got more blood than a normal person. So your blood volume has expanded up to about 140%. And within that blood, you've got increased levels of the clotting proteins. So you're prepared to lose blood when you give birth. And if you do, your blood should clot pretty quickly. And you've got extra stores to keep you safe.